Okay.
Go live.
Hello. Yeah.
Hello, good afternoon, doctors. On behalf of Hetero Healthcare, I welcome you to this webinar on Carbetocin in action. Our today's speaker is Dr. Bhavin Khambhati. Doctor, at Hetero Healthcare, we have got 25 years of excellence with 36 state-of-art manufacturing facilities. We are present, we have got 300 plus products in portfolio, and we have got presence in 126 plus countries. 21,000 employees globally. We are amongst the largest manufacturers of ARVs, APIs, and we have Asia's largest API manufacturing facility at Visakhapatnam, Andhra Pradesh. Hetero Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India. We have a wide product range encompassing multiple specialties like gynecology, orthopedics, pulmonology, and pediatrics. Pioneering in quality and innovation, we have distinction of bringing 4 biosimilar products to market within 5 years of initiation. Today's webinar, Carbetocin in action. We know that carbetocin is a drug which is used for PPH, and PPH is a condition which is potentially disastrous. It can lead to, the fatality is also possible. It's always good to discuss PPH in webinars and in theories and read about it rather than see a patient. And although there are many papers and many publications on use of carbetocin and PPH, it's always good to have our own doctor's insights into the management of PPH with the help of carbetocin. So that today we have got Dr. Bhavin Khambhati to share his experience about use of carbetocin. Dr. Bhavin Khambhati is MBBS MD, obstetrics and gynecology. Sir is director of Pragati Multispeciality Hospital, Prerna Multispeciality Hospital, Asha Nursing Home, and Mamta Maternity and Nursing Home. Dr. Khambhati has achieved several academic achievements. A poster presentation at annual MOGS conference, has conducted MD/MS hospital at BGMS Ahmedabad. Sir has participated in various elocution competitions and won awards for the same. Dr. Khambhati has consistently done well in academics all throughout his student life, with teaching of nursing staff MBBS, BHMS regarding obstetrician and emergency management, and Dr. Khambhati has conducted several scientific sessions on various social media platforms. Once again, a warm welcome, Dr. Bhavin Khambhati, and over the session to you.
Good afternoon, doctor. I'll say it is a very good and best choice for the in case of management because carbetocin has excellent result. My voice is cracking.
Yes,
okay. Okay. Yeah. Now it's audible.
Yes. Now it's audible.
Yeah. So I'm sharing my experience with carbetocin drug. It's a smarter, superior, and safer choice in PPS management. So the PPH is nothing, but it is because of atonicity of the uterus, or might be because of tear, trauma, or some coagulation disorder which led to PPH. And that if the blood loss is more than 500 ml during normal delivery or more than 1 liter in cesarean section, this will lead to hemodynamic instability in the postpartum patient and led to life-threatening in the patient. So we have to identify in the near miss cases and treat the PPH at the right time. Next. So it's a very common, PPH is very common in developing country, and India has a globally India has a high maternal mortality, almost 540 per 10,000 per 1 lakh live birth in case of PPH. Next. So what are the etiology of PPH? So if the uterus, the main reason is uterine atony, that is uterus unable to contract, which may lead to continuous bleeding from the vagina. Sometimes coagulation disorder, that the blood is not clotting, that the thrombin, and the trauma, that is a birth trauma, that during the delivery, or uterine rupture or uterine inversion and laceration in the cervix led to the PPH. And sometimes tissue like the placenta written inside, it will not come out because of abnormal presentation like abruption, placenta accreta, percreta, or increta. That will lead to PPH and a problem. Next. So what are the clinical findings in PPH? we have to see clinically, because the most important clinical finding is heart rate, blood pressure, and sign symptoms. So heart rate, if the heart rate is increasing, the blood pressure is falling down, so that is the circulatory collapse. The abdominal girth is increasing, the uterus is not contracting well, and the profuse bleeding from the vagina, as well as uterine tenderness. This is a sign of PPH. Next. So prompt treatment of PPH will lead to will decrease the chances of maternal morbidity and mortality. So rapid assessment of the patient is most important. We have to see the pulse BP. We have to see the vital sign. We have to see the blood loss. If the and this assessment at timely management associated with laboratory parameter will decrease the chances of maternal mortality. Next. So what is the approach? So if the I previously told there are 4T. So if the uterus is not contracting well, so we have to give the we have to give the carbetocin and uterotonic, that will decrease the chances of bleeding. If it is a tear or trauma like cervical tear or uterine rupture or uterine inversion, we have to treat that. And in case of coagulopathy, we have to transfuse the blood and treat accordingly. Next. So, most important molecule, as I found in my 17 year of practice, is carbetocin. It's a new heat stable formula, which is more superior than oxytocin, because it is and it the rapid onset of action within a stipulated time, within a 1 minute, will decrease the chances. And the carbetocin is available in a room temperature formulation now, and it is convenient vial also, so we have to give directly IV. Next. So there are multiple uterotonic agents like oxytocin, carbetocin, ergometrin, symptometrin, or misoprost. But when these are uterotonic to be used at the crowning of baby head, or after delivery of the at the time of delivery of entire shoulder, or at the end of second stage of labor, or and following the delivery of placenta. So this uterotonic will prevent the PPH, and that will also manage the active management of third stage of labor. And in case of if the PPH already developed, we have to treat with the this uterotonic for further treatment. Next. So this is basically, the carbetocin is basically a synthetic long-acting analog of oxytocin, and main use is for PPH, and it is available in vial form. That is 100 microgram of carbetocin in 1 ml solution for injection in a ready use. Next. So we'll discuss about the clinical evidence. There are a lot of study conducted in the that is the WHO conducted a lot of study, and this study proved that it is a more superior than the oxytocin for the use of for the prevention and management of PPH. Next. Uh, if we discuss about carbetocin with the oxytocin, almost there are efficacy is same and their safety is same in a trial of the WHO champion trial. Next. 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 So we'll discuss about case study for carbetocin.
Yes,
Next.
sir. I mean, these are the case studies, sir. Then afterwards we come to
Yes.
questions. Yeah, we can stay with
Yes,
case
fine.
studies.
Yes. So hold on. I have this write the cases.
Okay.
Yeah. So Mrs. Sadhna Gupta, G2P1L1 with 39 week of pregnancy. During third stage of labor, there was history of PPH during previous pregnancy, followed by blood transfusion. In view of high risk of developing PPH, one vial of injection carbetocin was given after delivery, and the PPH did not occur. That is for normal trial of labor. In cesarean, I discussing second case, that is during cesarean section. I have operated for primi gravida with 38 week of pregnancy with severe PIH. Patient is on labetalol tablet 100 milligram TDS. Induction was started for normal trial, but because of induction failure, the progress of labor not happen. So decision for emergency cesarean was taken. As a prophylactic measure, carbetocin given immediately after delivery, and there is no PPH. Okay, this is during cesarean section. And the third case is patient was IVF conception with diabetes and twin pregnancy. So it is over distended uterus. So it's a planned cesarean. So planned cesarean section done. As a prophylactic measure, because of it's a over distended uterus with diabetes and twin pregnancy and IVF conception, we have given carbetocin as immediately after delivery of the twins, and there was no PPH because it's a high risk case. In spite of this, there is no PPH. So these are the three cases which we can use prophylactically as well as treatment of PPH for the use of carbetocin.
That's very interesting, sir. After use of carbetocin, you did not experience PPH either in vaginal section
Yes,
or in cesarean section. So very interesting.
yes, yes,
Yeah.
yes.
And in all three cases had the potential. In our gynecology, we always say expect the unexpected. We do not know which patient will finally land in
Yes,
PPH.
exactly.
Yes.
Yes,
So
yes.
some questions which we'll ask you. What is your experience besides these
Sure.
three cases? What is overall? How long you have been using carbetocin?
See, since 1.5 to 2 years, I'm using carbetocin, and there is no single PPH. I am delivering more than 40, 45 delivery. I have
Absolutely,
two hospitals,
absolutely.
and
Yes.
both the hospital I'm delivering normal as well as cesarean section. There is no single case of PPH developed after the using of carbetocin. It's a routine habit of my during a cesarean section. My anesthetic immediately after delivery of the baby, immediately within a minute uterus is contracting because my anesthetic is giving
Correct. IV.
immediately IV because IV assess in the hand of anesthetic.
Correct.
So immediately he's giving carbetocin IV slowly, and there is no PPH at all. Matlab, since in long I have not using any, I have not done any uterine artery ligation,
Wonderful. Yes.
even not, yes, no manipulation, no bilin suture, nothing is required.
Wonderful.
So it's an excellent molecule.
So practically in all patients use carbetocin, maybe IV, maybe IM,
Yes,
depending on, yes,
I'm
yes,
using in all patients, but
yes.
if it's a high risk cases or any over distended uterus or gravida or prolonged labor or anything, twins pregnancy, even previous cesarean section or prior history of PPH, in that case, ideally you should use. But I am using in each and every cases
Absolutely,
because
absolutely.
I feel very safe. I feel very safe in using carbetocin
And in
with a
private,
almost nil side effect.
yes, and in private practice, cost generally doesn't matter here and there, little here and there.
Yes,
Yes,
exactly,
yes, yes.
exactly, exactly.
And patient wants the best finally.
Yes, yes, yes.
What is the patient profile? Any specific patient profile where doctors can anticipate a PPH?
Yes. So, high risk pregnancy, any
Ah,
high risk pregnancy like IVF conception, preeclampsia, twin pregnancy, even polyhydramnios,
mm.
even multigravida, okay, even previous cesarean, prolonged trial of labor, any over distended uterus,
There
there
is
are chances of PPH.
some
Yeah.
fibroids
So we
also
have to,
sometimes, yes.
yes, even fibroid also. So in that case, we have to use this uterotonic.
And sir, patients who have got diabetes, is there a problem in contraction of uterus or it doesn't
Yes,
matter?
there are chances because a diabetic patient might have
Of a T,
polyhydramnios.
correct.
Yeah,
Acha,
might have
polyhydramnios.
polyhydramnios and a big baby also, macrosomic
Yes,
baby
yes, yes,
also.
yes.
So uterus is already over
Fatigued,
distended.
yes,
So
correct.
in that case, yeah, in that case, there are chances of PPH,
Correct.
as well as there are chances that baby, it's a macrosomic baby. So
Yes.
might be chances of birth trauma also
Okay, correct, correct.
during delivery of the baby. Yeah.
When would you actually prefer carbetocin? It's more of a theoretical question because you have already been
Yes, yes,
preferring, yes.
yes. Hmm.
Possibly the answer is in all high-risk patients, which you have already
Yes, all
answered,
high-risk
yes.
patient. Yes, yes, exactly.
Can we use carbetocin in case of retained placenta?
Yes, we can use. I have done 4 days back. I have done one case. The patient was. I am just discussing the case. A very interesting case.
Yes.
It's a patient was delivered somewhere else,
Mm.
and my hospital had ICU and every backup.
Correct.
So generally, this type of high risk cases are referred to me. So that patient was delivered at their center. Then the placenta is not delivered.
Oh,
It's a kind of placenta accreta.
okay.
Okay, they have done sonography and sonology suggests it's a placenta accreta.
Correct.
Patient came to me with a profuse bleeding of hemoglobin 7 gram. Immediately transfusion done and patient taken to the OT,
40.
and umbilical cord is hanging.
Oh my God.
Just delivered 4 hour back, 3 hour back. I immediately this thing Carbetocin injected in the umbilical cord.
Oh, oh,
And
oh,
you
oh.
won't believe, sir, you won't believe. And immediately I have taken up with for the MRP, manual removal of placenta. Placenta delivered easily under
Oh,
anesthesia with NTG. With
God bless.
NTG, my anesthetic
Yes.
is given NTG,
Hmm.
and yeah, and immediately after delivery, मैंने तुरंत उसको वापस कैबेटोसिन
Correct,
आईएम दे
correct.
दिया.
अच्छा हो गया, सेव हो गए
Excellent
पेशेंट.
result.
Yes,
No
yes,
blood
yes.
at all. No blood loss at
Absolute.
all.
Because
Yes, yes, no blood loss at all. And that
I
accreta is managed from below only. From below only.
that's
No,
absolute
no
great. That's
OH is
absolute.
required.
This is exactly what
Yes.
our doctors would like to listen, sir. Your clinical experience,
Uh,
because this will give them an idea about the drug.
yes, yes.
Can we use carbetocin in RH negative mothers?
Yes, definitely, sir. We can use because it will not affect anything. Yes, sir.
And RH negative mothers, again, blood transfusion could be an issue, getting blood. I may not be in
Yes,
cities,
because
but in
yeah, blood loss.
interiors. Yes.
If at all blood loss happen by anyhow, whereby if atonic PPH and blood loss happen, it's a very difficult for us to manage the
Absolutely. Yeah, yeah, yeah.
blood from the blood bank.
Correct,
So in
correct.
RH negative, right now the crisis in Mumbai of all negative blood group.
Arey
Yes, all
Bapre.
negative blood group. Last day I have operated ectopic with 7 gram hemoglobin.
My God.
I didn't get a blood.
My
I
God.
operated laparoscopically. That done everything good, but already जो loss हुआ था उसको replace मैंने सिर्फ फिर injectable से किया,
My God.
Orofer से and
अच्छा
everything.
सर, मुंबई में ये सिचुएशन है तो बाहर क्या होगी इंटीरियर में?
Yes, yes, yes.
Can a doctor use carbetocin for
Yes, sir.
prevention if
Next.
he has used oxytocin for induction? Most of them would be using oxytocin for induction.
Yes, yes, yes. We are induced with
Yes,
the
yes. In
oxytocin.
fact, you are,
We
yes,
cannot
yes, you're
induce
already
with
using it.
carbetocin.
That's
Yes,
correct. That's
already
correct.
I'm following the same protocol. Ki I'm induced with the oxytocin,
Correct. Correct. You
and
said
then
so.
after delivery I'm using carbetocin. Yeah.
Carbetocin.
Yes,
In
yes,
which cases you would prefer IV over IM?
yes. As already told, the
Cesarean
high risk
section.
cases,
Yes,
any high
yes.
risk
High risk
cases in
case.
cesarean section, when
Correct.
I require prompt, immediate result, like within a minute.
Correct.
Okay, if I've required this thing uterotonicity, in that case I'm using, and although we are
IV.
using IV only,
Correct. Correct. Correct.
already the first time I used IM before 4 days back, because already I'm injecting in the जैसे बताया retained placenta
हाँ.
में,
Yeah, yeah.
umbilical cord
Umbilical
में
vein.
मैंने,
Yeah, yeah.
ये umbilical
Correct.
cord
Correct.
में मैंने ये
Correct.
दिया
Correct. Correct. Correct.
carbetocin slowly IV, and then it's separated, then I given IM because वो कितना गया we don't know.
Okay.
So in that case, oh, I don't know, but I have given IM when
दूसरा
it
फंड
really works,
दूसरा
because
फंड
already we have given NTG na, already we have
एब्सोल्युटली
given NTG, so uterus is again
डायरेक्ट
relaxed,
एक्टर है. और
relax हो जाएगा.
और फंडा है कि अगर यूज करना है तो आईवी यूज करें, फास्ट रिजल्ट आए.
Fast result आएगा. Yes, exactly. Rapid onset of action.
Absolute.
That's why. Yes, yes. Within a minute.
Correct. If
Yes.
patient is supposed by, I mean, sometimes it could happen, not responding adequately with carbetocin, what
Hmm.
additional uterotonics we can use? Except, I
So
think, except oxytocin all.
oxytocin, yeah. We can use methyl ergometrin, methazine. We can use prostrodine. We can put vaginally misoprostol also. And that's all. That are the uterotonic which are alternative we can use.
I mean, this could be a serious situation. SOS, we will use everything that we have in our hand.
Yes, yeah, exactly.
Yeah.
We are giving everything, all
That's
masalas.
correct. That's correct. I mean, I was in
That's right.
JJ and in my time, late 70s. I have seen one patient of PPH. Normal delivery, sir. देखते देखते patient went into PPH. At that time, we had only oxytocin and methyl ergometrin. The whole
Huh,
hospital was there in the rooms. All seniors,
huh.
all consultants. You know the situation,
Yes,
what it was.
yes.
By God's grace, the
And
patient was saved.
we are in a good era, sir, that a
Yes,
good molecular coming.
exactly, exactly.
So there are less. मतलब since 2 years, I have not seen any PPH.
God bless. वही मैं बोल
जब
रहा
से
इसलिए
मैं कार्बोटोसिन जब से
PPH
यूज
is
कर रहा हूँ ना सर, सिंगल केस नहीं. एंड आई
PPH
एम ए
is
हाई रिस्क ऑब्स्टेट्रिशियन. आई एम अटैच्ड टू 3 IVF center.
correct, correct, correct.
Okay, so all IVF patients are coming to me for maternity and everything, and we have ICU, so all high risk cases, eclampsia, we used to daily managing, but no high risk, no
And,
PPH at all.
and PPH is
God
always
bless.
good to discuss, not to see.
Not to see exactly.
What are advantage? I mean,
Yes.
आपने बोला ही है advantage और specifically misoprostol, carboprostol, methyl ergometry. What are the
Yes.
advantages?
Yes. See, advantage obviously oxytocin had a short half-life. Frequent doses is required. Okay, even sometimes refrigeration also required.
Correct.
And high for oxytocin, there are high risk of water intoxication in case of
Yes.
oxytocin.
ADH issue.
While
Yes.
misoprost, yes. And while misoprost, it's a delayed onset. It is given in the vaginally or orally. There are delayed onset of action. Sometimes patient might feel vomiting, diarrhea, shivering, even headache also. So in carboprost also patient develop vomiting, GI side effects. Even we cannot use in a
Asthma
case of
patients, sir.
bronchial asthma. Yes,
Asthma.
bronchial asthma,
Yes.
as
Correct.
well as there are chances of flushing of the face and everything, even headache also. Methadone, all the same thing. So these are the advantage over this thing.
These drugs.
Carbetocin has advantage over this molecule because I have never seen any patient vomited during cesarean. But
Carbetocin.
once prostadine given IM, अब हम क्लोजर कर रहे पेशेंट वॉमिटिंग ही कर रहा है. प्रोस्टोडिन दिया तो ये कॉमन है.
And for patient, vomiting
ऐसा
is a big thing, during
इवन
delivery. Yes. Aspiration,
बिग
aspiration
थिंग
हो गया
बिकॉज
तो
एस्पिरेशन का
yeah.
डर रहता है अपने को. हाँ, बहुत डर. एनेस्थेटिक फिर उसके पीछे लगा रहता है. पेरिनम दो, ये दो, वो दो.
How common is hypertension with methyl ergometry? BP shoot होता है. How
Yes,
common
I
it
am
is?
not. हाँ, sorry sir.
How common is
How
hypertension with
common?
methyl ergometry? Means with methyl ergometry, hypertension होता है commonly.
Hypertension with the methyl ergometry.
हाँ.
Sir, hello.
Hello. How common is
हाँ सर, ये
hypertension? हाँ.
हाँ.
How common is hypertension with methyl ergometry?
Yeah, obviously, if the patient is hypertensive, we will not give methazine because
Oh,
it's
correct.
contraindicated.
Correct.
Already increased the blood pressure. Yeah, it's already increased the blood pressure. We cannot give methazine and this thing. In that case, before that era, we are using carboprost and oxytocin.
Correct.
But now I am using
Carbetocin.
carbetocin in each and every cases. That's why.
Should carbetocin be kept as a reserve drug or should be used as a first line? आपने तो आंसर कर ही दिया. You are using it as
I'm
first line.
already
Yeah.
using as a first line drug.
And you have
Already
shared
using
your
it as first.
experience, especially retained placenta, is a wonderful experience.
Yes,
Sir.
everything. Yes, all high risk cases.
How do you compare side effect wise, adverse effect wise, carbetocin vis-a-vis other drugs?
As I already told, oxytocin had lot oxytocin, misoprost, carboprost, methazine had all lot of side effects. Okay, like vomiting, headache, loose motion, diarrhea, and everything. I have never seen any side effect with the carbetocin. There is no, not at all side effect. Like some patient might feel vomiting, otherwise no side effect.
Good. And one line, your take on carbetocin.
It's a super drug, wonder drug. And it's
आपने
a savior for all gynecologists, and it will decrease the chances of maternal morbidity as well as mortality.
It's a big thing, no?
So
Big
that
thing,
is
yeah.
most important. So we have to, still we are developing country. So this type of molecule will reach, will grade our country to the developed country in case of maternal mortality and morbidity.
And when you have the best, why take chance? That's another thing.
Yes.
Well, thank you so much, Doctor. It was wonderful, listening to your experience, especially the recent placenta. I'm very sure doctors would have benefited out of it. And it will give them a sort of confidence, the practicing doctor using it in high-risk patient. Thank you so much for your time and for
Thank
your
you so much.
experience and your case studies. Thanks. And a wonderful insight.
Yes.
Well,
sir.
thank
Thank
you.
you, sir.
Thank you all the participating doctors who took time from their busy schedule and attended this meeting. Thank you,
Yes.
marketing team Hitro for
Thank you, sir.
conceptualizing this. Thank you, field person of Hitro for coordinating. And thanks once again, IT team Jayant for super backup. Thanks all of you. Thank you, sir, once again. Signing
Thank,
off. Thank you.
yes. Thank you, sir. Thank you.
Thanks, Jayant.
Yeah, thank you.
We're again meeting at 4 o'clock now.
Yes, I will be join around 3:30 or 3:40.
Yeah, I come
3:30.
around 3:40, 45.